got back pain, this routine will help ease that back pain for you. In my last video, I shared with you why focusing on the back alone won't get rid of that back pain, and how we need to focus on the collapse into the front of the body, into the core, in order to relieve that back pain. Hello, my name is Catherine, and I support people to free themselves from pain so that they can move pain-free every day. In this video, I'm going to share with you 3 positions that we do in block therapy. So we can use a tightly rolled up towel, and there should be a link on my screen to help you roll up the towel tightly, and then, or you can use a block therapy block instead. So all we're going to be doing is placing the towel or the block in certain areas of the body. Now you can do this on a mat on the floor, you can do this on a bed, or you could do this in a chair. So if you're in a chair, just sit on the chair and place the tightly rolled up towel where your stomach is, where your belly button is, and you can add pressure and you can lean forward. Now if you're doing this position on a bed or on the mat, just place the towel on the mat, and then you want to slowly lower your body down onto the towel where your belly button position is. Now if you're pregnant, then you don't do this position because we don't want to be adding any pressure to the stomach area if we're pregnant. Now once you're in position, you will feel some pain, and we want to make sure the pain that we're feeling is only in the stomach area. So we don't want to be causing any strain to the upper body, the shoulders. So if you can't have your shoulders and elbows in alignment, you can come all the way down, or you can get some pillows, some cushions to support the upper body. Now what we want to do is we want to connect to that breath. So we want to be breathing, if you can, in and out through the nose. So breathing in through the nose for a count of 4, and you want to feel that belly expand on the towel or the block. So just pushing that belly out, and then when you exhale through the nose for a count of 6, you want to feel that belly button going small. Imagine that belly button's touching the back of the spine. And we want to stay in this position for a minimum of 3 minutes. The pain that you feel is due to inflammation, undigested food, or waste that hasn't been eliminated. All this is normal as long as you can breathe in a relaxed way. If you ever go into a position and you can't breathe in this relaxed way, then you need to either come out of the position, loosen the towel, or go back to where you could breathe in that relaxed way. And then once you finish, place your hands underneath the shoulders and exhale up and out of position. The next 2 positions we're going to do are on the hip flexors. So we're going to start with the left hip flexor, but we will do the right one as well. So just finding that hip bone, and you're placing the towel directly underneath it. It can be on a slight angle, it can be straight across. Don't worry too much, just in that area underneath that hip bone. Do make sure that your towel is tightly wound up, because it may have compressed or loosened whilst being in the belly position. So all you're going to do is place this towel or the block on the mat or the bed. Now if you're doing this in a chair, you would just place it where the pain is here, and you would lean in and have pressure this way, sitting on a chair. Now you want to straighten out the left leg and bend the right leg out to the side. Again, you can stay up on your elbows if you're able to, or you can come all the way to the floor, or get those support cushions again to support that upper body. We only want to be feeling pain in the area that we're searching for, and so underneath that hip bone. Again, we'll be connecting to that full breath, so breathing in through the nose for a count of 4, feeling that belly expand, and breathing out through the nose for a count of 6, feeling that belly going small. And then you can start to do, if it feels comfortable for you, some searching for that pain. So you want to be finding the pain and then breathing it out with the body. And you can do this by lifting the foot up, coming onto the toes, or you can lift the leg up completely. You can angle the foot. Now all these suggestions that you would do very slowly. We don't want to be rushing through any movement, because you want to find where the pain is, stay there for a few breaths or until it eases, and then search for more pain. And again, you want to be staying in this position for a minimum of 3 minutes. You can always stay as long as it feels good for you. Your breath is always your guide. And then when you're ready to get out of position, place your hands underneath your shoulders and slowly exhale up and out of position. And then you want to go over to the right side, tightly roll up that towel again, placing it underneath that right hip bone, straighten out that right leg, bending the left leg to the side and staying in that position for 3 minutes as well. So the next, last and 2 positions is the pecs. So if you get your right hand and place it into your left armpit, where your thumb comes out is roughly where we're going to be putting that block or towel. So again, tightly roll up that towel, get the towel or the block, and you'll be placing it roughly in that area. So your arm will be out to the side and will be lying on the towel. You can have your arm bent if you're not able to have it out to the side, and you can do this on your knees if you don't want to be lying down. Usually on a higher end it gets more comfortable, but I'll show you this. And again, you can do this on a bed or on the floor, and if you're doing it in a chair, what you need to do is, or maybe a surface, you can have like a table, is placing that on and leaning into the block or the towel to add pressure here, so that you're leaning down onto your legs. So let's place the towel or the block on the surface that you're using, and then come down onto your stomach, find roughly that pec area, straighten out that arm if you can, or have it bent, and then face your hips to the mat, looking down, we'll make sure the neck's not in a vulnerable position, and then let's connect to that breath again. So breathing in through the nose for a count of 4, feel that belly expanding, and then breathing out through the nose for a count of 6, feeling that belly going small. Now again, you can start to search for some pain, and you can do this by adding more pressure by coming up onto the right hand. You can push into the left pec area. You can raise your arm off the ground, coming onto the fingertips if raising it is too much. You can make small movements, moving the arm down and up, or rotating the hand, just searching for where that pain is for you. But always remembering that your breath is your guide, and if you ever take yourself into a position where you can't breathe in a relaxed way, just either go back to where you could or come out of position. And again, stay in this position for a minimum of 3 minutes, and then when you're finished, place your hands underneath your shoulders and slowly exhale up and out of position. And then go over to the right side, putting your left hand in your armpit, finding where that thumb is, and just placing the towel in that area, and doing that for a minimum of 3 minutes as well. So those positions, so the belly position, the hip flexor and the pec, are just 3 positions that can help to ease your back pain. When we are not conscious of the way that we're sitting and standing, and we start to fall into the core, this puts that strain on the back, the lower back, the upper back. And what we've done today is opened up that core, started to create some more space in the body, inflating that space with the breath. And now as you sit here, just feel how you feel. You may feel it's easier to sit upright more. You may feel it's easier to put those shoulders back and down, or you may feel a little bit more pain. The more often you do this, the more you're going to open up the space in the body. So this is a lifestyle change. It isn't a once try it and it's fixed. We need to be opening up the body, getting rid of that compression and decompressing the fascia with the rolled up towel or the block therapy block. And this is what we do in my online classes. So there's a link in my description where you can attend an online class. These classes are held online, they last for 60 minutes, and we cover the whole of the body. The whole of the body does need to be decompressed, because we have compressed, we've lost space in all of the body, and it's all connected. So if we're not working the feet and releasing the restrictions in the feet or the leg, this is going to have an effect on the hips, the upper body. If we're not releasing the hands, the forearm, this is going to have an effect on the shoulders. So everything is connected, so we need to make sure that we're always decompressing the whole body and using that full body approach. And that's what I'll talk more about in my next video. Thanks so much for watching, and I hope to see you in class soon.